Good afternoon, and we're going to end the afternoon with a synthesis session to kind of just identify some of the key takeaways and potential opportunities for action that can go forward from today, as well as some key themes that you might have identified throughout the day. This first part is actually just going to be talking about the breakout sessions and just getting from the moderators of the breakout sessions their key top 2, 3, 4 takeaways from their individual breakout sessions. So this will bring the online folks up to date with some of the key points that took place during the breakout sessions. So let's see. Oh, and actually, I probably should have started out by introducing myself. Sorry about that. My name is Tom Field. I'm the Associate Vice Chancellor for Organizational Development here at the Medical Center. And it's a real privilege to have y'all here in the room today and so many people online. It's really wonderful and wonderful to welcome you here to Kansas City. For those of us here in the room, you're in the Ad Astra room. And in case you were wondering kind of where that comes from, our state motto is Ad Astra per Aspera, which means to the stars through difficulty. And today we've heard a little bit about the difficulties that face us in medicine, particularly in our rural settings. And so this last part of the day is really to focus on that to the stars kind of thinking, and the big thinking about good opportunities that we have to impact people in some areas that require the most need of y'all's services and those of your colleagues. So we're going to get started by, as I mentioned, prematurely with just a overview of what took place in the breakout sessions. While we're doing that, I'll go ahead and capture those key takeaways. And so we'll go ahead and get started with breakout room number 1, which was team-based integrated care. So if you could mention the key takeaways that y'all had, and I'll step over here and capture.
Okay, great. So we had a very robust discussion of a lot of things. So I'm trying to prioritize what to highlight. I think we really started with, if we're going to build capacity in primary care, really thinking about the why, like why are we doing this work? And making sure that there was a very clear vision and values, because a lot of the other things that would be needed would build off of that. For example, thinking about what is important to primary care providers, that this can't just feel like more work if we're now asking people to actually address behavioral health. We also talked about a bunch of other important needs. So things like IT infrastructure, being really clear on sort of building ecosystems of care. So what are the other strategies that you might be able to use to complement a behavioral health integration approach? So things like e-consults, other kinds of patient directed materials, like, for example, online therapy or patient self-directed materials. And then we talked a lot about thinking about referrals for capacities outside of what primary care could deliver, and maybe the importance of thinking about how data might help us track what's happening to patients, because there was a lot of discussion of how hard it is once you refer sort of outside your system to continue to get information about patients. I don't know if I captured everything, but those were a lot of things.
Wonderful. Thank you. And I'll finish this up here in a second. Let's see. Takeaway or breakout room number 2, rise in technology solutions.
Yeah, hi, Greg Ader, and we had about 15 people, and we had a great conversation, a wide-ranging conversation. And the team members, if I leave something out, please help me out. But I think the overall sort of takeaway was that it's the requirements are rather intense for technology, and so what it is that we're trying to do in the exam room is a very complicated task. It's fraught with disruption, with with all sorts of drivers, and I think particularly the rural in the smaller hospitals where people have multiple roles, and just being able to keep up with the regulations and the drivers from the outside. It's something I touched on at the talk with the fact that there's one author of the record, but there are many consumers of the output. And so we talked about the idea of a consortium or convening groups to look at what are the irritants in the day-to-day life of providers, and what are, can we then coalesce around solutions, helping consumers of those solutions understand what's available and relative to the requirements. But also, I think a theme of regulatory relief. And I think a great example of that, of course, is the way the compliance folks look at a medical note as, well, if it's not on the piece of paper, it didn't happen. Well, as it turns out, there is a log that goes with that. So modernizing a lot of the regulations into an EMR world where there's an access log, and that will prove whether or not I looked at stuff or not. I think the theme of bringing bring a regulator to work with you and help them see on a in up close and personal what these regulations look like as we try to implement them, the competing measures across organizations and across different government entities. So I think the concept of convening and trying to help with solution selection was predominant. Team, anything else? Thank you.
Well, thank you very much. I heard the chuckling on the bring a regulator to work thing. Prior to this role, I was our compliance officer for a time, and one of the things we did do back then was have the groups we were serving, such as like our research scientists and stuff, come and talk to the people in our office, and doing that actually really helped give us a broader picture of what the people we were serving were trying to do, rather than the narrow scope of what the regulations say. We still have to, be true to those, but it did really help to make it more of a partnership rather than an oversight type of thing. So I heard the chuckling, so I just had to comment on that. All right, group 3.
All right. So we had a really nice discussion. One of the things that came up is that medicine is a rigid space with really clear rules that are often unspoken and we say that we want diversity and we bring people into that environment, and then we expect them to not do all the things that make them diverse and unique. We expect them to then adhere to all of these things that are never articulated until they're told that they're not doing what they were supposed to be doing. So really creates an inclusive space because we're not telling them the rules before they get there. We talked about barriers to achievement. We say we want diversity, and then we put up obstacles with experience requirements, financial barriers where it's impossible for them to actually get the experiences that we expect them to have as they come in. So again, saying, yes, we want to recruit a diverse workforce and people coming in, but there's no pathway for which they can reasonably achieve those things. Talked some around about acknowledging that different demographics have different needs, specifically around things like calendars, family obligations, and how they step in and out of the educational environment and create space for that. We talked about that there's going to be conflicts. Sometimes the conflicts are between students and faculty. Sometimes it's between faculty and staff, but really creating an environment and using technology to really focus on what the needs of the students are. And then we did flip it a little bit and talk about the needs of faculty and staff. So if we're creating diverse environments and we're expecting faculty and staff to lean into this, how do we support the faculty and staff in getting credit for those things? So how are we training them to be mentors and coaches? How are we training them and supporting them and providing flexibility around different learning needs for different students? And how are we rewarding that behavior within our academic structure so that they're not being penalized for taking on students who need additional coaching and additional support, but we're actually rewarding the behavior that we say is aligning to our mission. Looking to see if there's anything else. Really institutionalizing, the last thing was kind of institutionalizing policy. So if we have people who are really leaders in this space, what happens when that leader leaves? Does that culturally change the institution, or has it been hardwired into the institution to ensure that we are actually continuing this work and that we're supporting students and faculty and staff and learners that come into the environment to ensure that they're successful? Did I leave anything out? All right. Thank you all so much.
Right. Excellent. So that was the feedback from our moderators in the breakouts. Sounds really robust and comprehensive. Anything, just a quick check, anything that anybody else experienced in the breakout that you want to mention and make sure I get up on the chart? Or did they do a pretty darn good job? All right. I guess pretty darn good job. All right. Thank you. All right. So the next exercise is just to identify from you, the participants here in the room, and then also those online, from your experience today in the sessions, the group sessions here, the breakouts for those who are in those. Just take a minute of silent reflection to think about any cross-cutting theme that you kind of feel came out of today. So I'm going to hush up, give you about 1 minute just to silently reflect on any cross-cutting theme that you might have heard or experienced today. Okay, now I'd like you to go ahead and pair up. If you're at a table with an odd number of people, that's fine. You can do a group of 3. But just take about 2 or 3 minutes to talk to one another about the key theme that you identified. So in a pair or at the most a group of 3. And if you feel free to move around too if you want to meet somebody new. All right. So the last part of this exercise is to now as a table. So if you're at a table with just 2 people, you might want to pair up with another pair. But what I'd like you to do is as a table, go ahead and just co-create a key theme statement based on the experiences of people at the table. It could be, a handful of words. It could be, formal sentence or what have you. But just kind of co-create as a table what you think the key theme for today was from your experience. And once you've done that, go ahead and take a marker that's at your table and pick one of the flip charts around the windows and write it up there. So we'll have about 5 minutes for this or so. Any questions about the assignment? Okay. All right. So the next step that we're going to do, we've just got 2 more brief exercises to round out the synthesis session. The first involves this URL, or not URL, QR code. Thank you. Good grief. So the folks online have already logged into this. This will be for prioritizing the big ideas that we gathered from the tables earlier today. So go ahead and if you have the opportunity to scan the QR code, and then in that code, we should have a poll which lists the big ideas that were listed earlier today at the tables. And what you'll be able to do is shift the ideas. And what basically we'd like to ask you to do is look at the list and just move the top 3 that are important to you to the top of the list. So you got 3 votes. If you get real wild and crazy, you can prioritize the whole list. But all we're asking you to do right now is to identify the top 3 big ideas that you think will help advance this cause today. Okay. So if you still need more time, keep voting. But it's really interesting to look at the results here and just as an observer today, the structural change, which is so important, the idea of letting people align to that shared sense of purpose so that they're empowered to go out and do great things. And then that idea of listening to everyone involved in that care relationship is stuff I had in my notes too. And so it's really cool to see that reflected in what y'all heard too. So the last exercise that I have on, and it'll be a little different approach for the people in the room and the people online. For the people in the room, there are little index cards and envelopes at your table. Go ahead and grab an index card and an envelope. For the people joining virtually, if you have a piece of paper nearby, grab it. Or if you want to just open up an online note or something like that, go ahead and do that. There's this concept that we learned from a group called the Plexus Institute. Our School of Nursing had them in, a decade or so ago to teach us what are called liberating structures, which are facilitation and discussion techniques designed to make sure everyone's voice is heard. So when we did the one, two table all thing, that was at play there too. A lot of times you'll have people like me who, oh, you probably can't tell from now, very shy, don't usually speak up much, and like my sister, who is very expressive and talks all the time. I never get a word in edgewise. I'm just always quiet. But it's designed to allow that individual reflection time to kind of hold back the really expressive people and give the quiet people time to have some time to think. Then that pair discussion is a safe, really kind of opportunity for people to use their voice. And then it just kind of grows. So the 15% solutions is what we'll end with. And the idea there is that in each of our lives, we really only have total autonomy and control of over about 15% of our life, where we don't need to ask a boss or a colleague for permission. We don't need to ask a spouse or a friend for help or assistance, where we don't need to ask the CFO for additional funds, where we can just understand what's important to us and do it. Today, y'all have really been focused on improving the lives and communities that you serve. So really focused on your patients and your communities. What I'd like you to do now is think about well-being as it relates to you. So the question that I'd like you to just take a moment to think about is, over the next year, what's one thing that you're going to commit to yourself to do to just make your own well-being better, to make your life better, to belong in the community where you're at, to not be stressed at the end of the day? What's one simple thing you can do where you don't need anyone else's permission or support or funding, what have you? So when you got that, just go ahead and write it down on the card. And this isn't anything that you're going to share with anybody else. It's just for you. So let me give you a minute to do that. And for the folks at home, go ahead and do the same thing and just write it on your sheet of paper or in an email you send to yourself or something like that. And whenever you're done, go ahead and put it in the envelope and seal it and write, "Do not open until December 31st, 2024. If you're doing it at home, just send it to email, subject line, "Do not open till December 31st, 2024. So you got a year. So in a year, go ahead and open that up and see if you were able to follow through on that commitment to make your own well-being better. If you feel really ambitious, you can put an earlier date. I'm not going to hold you to December 31st, 2024. But anyway, once again, it was an absolute privilege to have y'all here in Kansas City on our little corner at 39th and Rainbow. It was a delight to welcome people from all over to join us virtually. And just thank you very much for the work that you all do for your patients, for your communities, to make lives and communities better. Let's see, I'm supposed to, I think, turn it over to you for close. All right. Thanks, y'all.
So on the agenda, it says Tom Naska. I'm Darrell Kirch still. But channeling Tom for a couple things. First of all, is there a slide following this? I really want to thank Helen, you, and the planning committee. We should also thank them because they put together a great meeting. Also, I want to thank our colleagues at the KU Medical Center for hosting us. Now to show you learned something at every meeting you attended in every place, one of our KU colleagues pointed out that if you go over there, you have one of the places with the worst health outcomes in the United States. And if you go to the suburbs over there, you have some of the best. And it just is such a fitting observation that we're in this beautiful setting, but right between our healthcare system at its best and at its worst. I don't know about you, but if I'm going to climb on a plane, go to a meeting, I want to leave inspired. And this meeting has truly inspired me. And the reason it's inspired me is because when we started this journey, this formal journey, I mean, the problem of burnout, stress on clinicians has been there forever. We just were in denial. But when we finally confronted our denial, I would say it dates back to about 2015, when organizations started doing individual work on this, and then 6-ish years ago, when the National Academy conceived this effort, I really wondered, you know, could we make a dent of any kind? Our system is just, in so many ways, it is the ultimate leaky bucket. You know, just not working, not retaining our workforce, not inspiring them, not comforting them and giving them a sense of group. I didn't know how much traction we should gain. And I believe we've gained a lot of traction. But the thing that inspires me about today is we were talking about some of the toughest situations you can imagine. I mean, when I think about the Indian Health Service, you know, treating this population that our nation has treated so poorly historically, it's the ultimate under-resourced system, and working in places like the bottom of the Grand Canyon, the Aleutian Islands. They lead healthcare services there. Places where there are real Americans with healthcare needs. I was really inspired to hear about how they could do something like have in the Navajo Nation the highest vaccination rate in the country. I was very inspired to hear the story of, I think Dr. Anderson had to leave, but if you had told me that the most successful clinician recruitment efforts right now were going on in the western part of Kansas, having been to Salina, Kansas, and related areas, I couldn't believe what he described. But it just shows if you have will, if you have a sense of purpose, if you have a sense of creativity, including, and if you have some friends with jets, I know we all noted that part, but if you have those things, even if you only have 30 days of cash on hand, you can get it done. I found that incredible. I loved the AI presentation. So when we started the clinician well-being work, those of you who were there at the beginning know everybody wanted to blame the EHR. And so we had a whole generation of physicians saying technology is going to destroy my world, or has destroyed my world. And now we have AI, and those same clinicians are saying AI is going to make it worse. It was so heartening to see a real tool that could make my, you know, if you could make my life 20% better, count me in. That is significant. And then I mean, and also to hear about a medical school in Salina and a medical school in the Cherokee Nation. I wouldn't have imagined that a mere 10 or 15 years ago. We are gaining traction, and it's because more and more people are being recruited to saying the future health and well-being of our clinicians is every bit as important as the health and well-being of our patients. So I hope you felt a fraction of the inspiration I have when you go out. I want to thank you all because this was such a engaged participatory group. For those of you, oh, and we had over 200 people online. I want to thank all of them. They, I think, were equally inspired, but they also did what we do. They caught up on their email while they were on the webinar. Thank you all. I hope you have a great afternoon. For those of you, oh my gosh, they're so good. They get taken for granted all the time. On Catherine, Bram, Farida, Kimber Bogard, who is leader of this group. I said on, and but I said it with a kind of Kansas, Colorado accent. And Kimber Bogart from the academies, the senior leader of our staff team. Thank you all. Have a great day. Travel safely. Now, if you're members of the collaborative, we're going to have our second part of our closed meeting at 4:30. So the collaborative members who can reconvene here at 4:30.